So I'd just like to start out and have everyone introduce themselves and what company they're with, and just tell us briefly, what is it that you are personally excited about as it relates to the psychedelic market? So Evan, start with you.
Thank you very much, Andrea. Thank you, everybody, for being here today. I'm really excited to be on this panel, and thanks for the invite from VDAC as well. So I'm Evan Levine, Chief Executive Officer of PsyBiotherapeutics. I've been working in life sciences in different areas for most of my career. Started off in middle market healthcare and technology banking, moved into portfolio management, where I managed a large private equity portfolio of biotechnology and technology investments directly into companies. And then I moved on to executive operational experience, where I've run global clinical trials in Europe, the United States, and South America. I've run phase 2s, phase 3s, and 505(b)(2) equivalent studies. I founded PsyBiotherapeutics based on the excitement that's coming into the psychedelic market. I won't take too much time, I know everybody, but we'll talk more. Thank you.
Saad?
Thank you, Andrea. So my name is Shah Shah, and I'm the CEO and co-founder of Noetic. We're a fund that's focused strictly on mental health. And in particular, over 50% of our investments, which are direct investments, are focused on psychedelic drug development, drug discovery. But we also look at other modalities. We're trying to solve the mental health problem. I've been in asset management for over 25 years. Built a fund of funds business in 2005 and sold it to Carlyle in 2014. But this is very, very, very personal. It's an area that I've been studying personally for about 20 years. The efficacy rates are profound. And I think one of the key things is this. You've got a bit of a Goldilocks moment. You've got incredible development that's taken place over the last 5 years in this industry. We know more about the functioning of the brain in the last 5 years than we have at any other point in history. And secondly, so it's a golden era for neuroscience. And then, of course, the pandemic has really exacerbated the situation in terms of our understanding of mental health. So mental health is no longer a stigma, and hopefully in due course, further discussions about psychedelics and its efficacy will also not be a stigma. Thank you.
Hello, and thank you as well. I feel honored to be here, and thank you for the invite. My name is Jeffrey Becker. I am a clinician, functional psychiatrist. I've worked for about 20 years in ketamine-assisted psychotherapy. I have thousands of treatments under my belt. I came to develop and start Bexson BioMedical about 5 years ago in order to bring ketamine to market through subcutaneous delivery for pain management and also for mental health indications. And in the process, we actually have developed a new pharmaceutical technique to make subcutaneous formulations. So we're now moving into psychedelics as well, and are very excited. I'm very excited about kind of the movement out of the psychedelic 1.0, which is the last couple of years, into kind of 2.0, where companies are maturing and developing real-world technology that can be applied in the medical clinics with kind of with realism as to what that means.
Liana?
Thanks, Jeff. Hi, everyone. My name is Liana Gillooly. I work with MAPS, the Multidisciplinary Association for Psychedelic Studies. MAPS is a 36-year-old nonprofit that's been pioneering the research into the beneficial uses of psychedelics. We've done initial research into most of the psychedelics that you can think of and are currently in phase 3. We just finished enrollment for our second of 2 phase 3 trials for MDMA-assisted therapy to treat PTSD. In about 2015, when we realized that we could market MDMA as a pharmaceutical product, we started the MAPS Public Benefit Corporation. And if all goes well and if we get approval, it'll be the first company on the planet to have a psychedelic-assisted therapy protocol approved by any regulatory agency anywhere on the planet. We're also doing research in Israel and Canada that are both in phase 3, and we're about to open research in 7 countries across Europe and other places around the world.
So let's talk about the history a little bit. And Liana, you have probably a better understanding of this than anyone, because MAPS has been involved in the early stages of psychedelics. Can you tell us a little bit about the history and the evolution of this category?
Sure,
and how it's changed?
I've been involved with MAPS since 2010. I did a 5-year detour into the cannabis industry where I worked for the largest investor network, at the time, and then I came back into psychedelics. And in 2010, it was completely taboo to get up on a stage in front of people and speak about this topic out loud. So we've just seen a dramatic shift, and the main reason that that has changed is because of the strength of the research, which was mentioned just earlier. The history, there's a really robust history of research into psychedelics in the 1950s and the 1960s. It got out of the lab. We all know the story. But there was always a huge signal and a huge desire to investigate these molecules because they're so interesting, and there's more that we don't know about them than that we do know about them. And now, just in the past few years, really when MAPS got permission from FDA to move from phase 2 to phase 3, we saw this huge explosion of new companies starting and new research getting initiated. So at this point now, we're in what some call the third wave or the second psychedelic renaissance, and it looks and feels entirely different because we have such incredibly robust and strong science backing us up. I'll also mention that MDMA wasn't made illegal until 1985. All the other classic psychedelics were made illegal in the Controlled Substances Act of 1970, and so there was a 15-year window where therapists were using MDMA in their practice. So we have a huge body of information, and when Rick Doblin started MAPS in 85, 86, he came in knowing that MDMA was very effective for the treatment of trauma due to all of this anecdotal experience with thousands of people being treated in therapy sessions.
That's great. Yeah.
I'd like to add to that excellent history, but psychedelics are some of the most interesting molecules on the planet. They have been around for thousands of years. We have evidence in cave paintings of both human beings and animals ingesting these drugs. We know through history they're mentioned in the Bible, they're used throughout the Bible. Fast forward to Middle Ages, they've been used, and look at Native Americans have been using these molecules for healing purposes and spiritual purposes for many, many years.
The ancient Greeks as well, there's a great book called The Immortality Key, which elucidates how the ancient Greeks likely also used psychedelics. Aristotle, Plato, all of them, yeah.
So one of the first moments, I think, where this class has been legitimatized is when it was being studied with veterans, actually, in post-traumatic stress disorder. Saad, do you want to talk a little bit about that and what happened with those studies and from the veteran perspective?
Yeah, no, I mean, look, you've got an incredible push by the Veterans Affairs, and people don't really realize this, but there are more deaths in the armed forces through suicide than there are in combat. And that rate is double for women in the armed forces, right? And so a lot of funding has come from the likes of DARPA. A lot of funding has come from the likes of, the U.S. Department of Defense. And it's both to find a way to treat veterans, of course, but also how can we actually reduce the level of PTSD at the time when they're in battle, right? And there's a great anecdote and stories with regards to ketamine. If you administer ketamine on the battlefield to soldiers that's gone through a traumatic event, because of the ketamine, their perception of that particular traumatic event is significantly reduced. So a lot of funding has been put in there, and that sort of a backing has been very important to the psychedelic renaissance movement, because regardless of what side of the aisle you're on, whether you're a Republican or Democrat in this country, I mean, outside of the U.S. it's also huge, but in this country, regardless of what side of the aisle you're on, it's a very important initiative. And so not only is there political will behind it, there's funding behind it, and that research that the funding has generated has been very, very important to getting us to where we are today.
So we know it's a large market, right? We know that we're going to another level of an epidemic, potentially larger market. But there are also a lot of drugs that are currently on the market, right? SSRIs for depression. In each of these categories, there are drugs on the market, right? So why is there an unmet need? And Jeff, maybe if you can speak to that a little bit, why does this class represent a medical breakthrough that doesn't exist in the current classes?
Yes, it's hard to understand if you don't understand the way that the brain is organized. So I'm going to take just a quick quick primer on kind of the organization of the psyche at some level. Huge generalizations, I would get killed at a science conference, but these generalizations actually do hold water. And it's particularly useful for understanding how these work. When we talk about thinking, basically what we mean is exchange of information between a set of cells called pyramidal cells. It's basically the exchange of information back and forth. There's a lot of tracks, we call them, that can flavor how we think and the speed with which we think and whether there's emotional content connecting between areas as we think. But the thinking itself is really at some level the exchange of information across these pyramidal cells. The pyramidal cells are deeply controlled by a net of neurons called the GABAergic interneuron net. It's essentially inhibitory, and it stereotypes and controls what pyramidal cells are allowed to think and interact. It basically controls the patterning. One of the things that humans are exquisitely good at is changing the patterning of how they think based on their experience. And so when you have an event where you literally think you're going to die, or you are abused as a child, and you feel unsafe in those very, very important years, the patterning becomes kind of stereotyped and rigid and constrictive. And people will fall into these spaces where almost literally you might think of it as constricted scope of consciousness, that actually they feel small. They feel small in the sense that they will often have the same set of thoughts over and over and over again. It actually can be kind of terrifying how small people get. We have versions of psychotic depression where people are, they literally get to the point where they can't move anymore. So the stereotypy, the constrictedness, you can think of the stereotypes as kind of a rigidity in thinking. Breaking those patterns is very difficult with the standard medications that we have. They can do it a little bit, but we don't have anything near the kind of power, the effect size that we have with psychedelics. What happens with the psychedelics is that they attach to that pyramidal cell that, again, is controlled by this GABAergic interneuron net, and it causes them to be more likely to fire. It's kind of that simple. What that allows them to do is to overwhelm that inhibitory tone that stereotypes the thinking. And what it does, we know this very clearly, the science is amazing on this in imaging. The fMRI studies are showing very clearly that these particular interactions, we call it the default mode network, there's the executive network, there's a salience network. You can think of this as who I am, what I do, and what's important to me. These all interact in very specific ways in your everyday consciousness. The psychedelics basically can disrupt those networks and cause that inhibitory tone, that inhibitory net of control, to give up the game and learn new ways of seeing the world. And that's why we see the healing. It's a bit, I kind of went off a bit, but I think if you understand that, you can understand why this is such a key treatment for human beings. It's been a long, long time coming. They're here now. We feel very, most of us who are old guard and have been in this for 20 years, we feel very excited. We're also being very careful to try to do this right because it's extremely important.
So Jeff, sort of just to compare that to the existing market, right, in simple terms.
Yeah.
So as we look at the pharmacology market or pharmaceuticals, it's strictly a chemistry kind of reaction. But if we look at the brain or the human being, we're a multi-dimensional being, right? So we tend to put things in the psychiatry market or psychology market or pharmacology market, right? But the brain is much more complex than that. So one of the things that I found interesting in this is sort of the emergence of your unconscious with your conscious, for instance, right? So there's this moment of clarity where your unconscious can actually decipher, and you can leverage your body's own intelligence to figure out what's fundamentally causing that distress. And also we tend to put things into boxes as human beings, right? We put anxiety, depression, and post-traumatic stress disorder into different categories as an investor market and even as an FDA indication, right? But our body's mechanism could converge all of those things. You could be depressed and anxious. So what's interesting about this market, even though we will study it from an indication by indication basis, our bodies are able able to be unleashed to sort of find some of those things. So Saad, do you want to
Yeah,
talk
you
about
know,
that?
Carl Jung has a quote which is, until you make the unconscious conscious, you will repeat the same mistakes over and over again, and you'll call it fate. So it's important to make what's unconscious and be conscious of it. But what I just wanted to follow up with what Jeff said, it's important to know this one little aspect of history. John Cate discovered lithium to be applied for mental health purposes in 1949 in Australia. It came to the US in 1950. At that time, if you had a serious mental health ailment, you were institutionalized, you were hospitalized. When lithium came onto the scene, hospital beds were freed up by 70%. Just think about that. 70% of hospital beds now freed up, lithium. So you thought that you found the holy grail for mental health. We don't need to innovate here anymore. We've got the answer. Let's focus on, getting man to the moon and doing other things. There's been very little innovation as a result. Prozac, which came out in the mid-'80s, is literally a slight design improvement to lithium. That's it. And everything else from that point onwards is a slight design improvement to Prozac, and you understand where this is going, right? So again, there has been a lack of innovation, but that innovation caught up from 1995 onwards, when all these researchers and scientists that have been working with psychedelic medicine, really funded a great deal by the likes of Stan Grof and his work and others in the area, they got together in Esalen and they started to share notes, and they realized, holy cow, you've got this anecdotal evidence, you've got that, this is pretty profound. We can get funding on the back of this at the various institutions, the academic institutions, and that's what really spurred the growth. And we are now here today with a lot more research behind it and actual solutions to lithium-backed and glutamate-based SSRIs that are going to be game-changing. And we've already seen it be game-changing.
So let's go into a little bit of the specifics, right, by indication. So we have anxiety, depression, post-traumatic stress disorder. We have substance abuse. There's a lot of different indications and a lot of different types of medications that can treat those, right? So I would love for each of you to go into a little bit of, what is your company studying? What is the indication? How does it work? Why do you think that there's promise for that specific category? So Evan, do you want to start?
Sure. So PsyBiotherapeutics, our value proposition is that we grow these psychedelic drugs with bacteria, genetically modified bacteria. So it's a production method, but we're a drug development company and discovery company. Our initial clinical trials are going to be with biosynthetic psilocybin. And I should note that we are an investment conference, talk about the opportunity. Nobody actually can own psilocybin. It exists in a mushroom for thousands of years. There's no real intellectual property on that molecule. What we have done, and we have an enormous patent portfolio. We filed 16 patents on the production method of using genetically modified bacteria. And this was a research first, using a recombinant host to very efficiently convert into some of these alkaloids. We just make it far more efficiently. It's faster and it's far less expensive than using any other production method for psilocybin and some of the other molecules we synthesized. So that's our value, that we can make it a lot less expensively and a lot faster. But we've been building up this portfolio. We have 100 molecules in the portfolio, and we have molecules with different characteristics. At PsyBio, we have 3 different laboratories. We have an academic laboratory for discovery and optimization. We have an industrial laboratory that we're converting to CGXP over the next year. And we have our own dedicated vivarium, where we do animal studies on a daily basis on multiple tryptamines and phenethylamines. And we look at the interactions as well between these, and we found some very interesting combinations. And we've also discovered some molecules that are acting equivalent to Prozac and psilocybin in rodent models for anti-anxiolytic and antidepressive activity. So all that being said, we're initially working in depression. That's with these animal models. We are going to be filing an IND shortly on a subcategory in depression. We haven't publicly disclosed that, but we had our first pre-IND meeting with the FDA, and they gave us the affirmation on 10 different indications in that area.
Great. Saad, you have a fund that's exclusively focused on mental health. How do you determine which companies that you invest in, and what is the criteria that you use?
Yeah, we started in February of 2020. We looked at over 400 opportunities. We've invested in 28 companies, PsyBio being one, Bexson being one. So for us, we're trying to solve the problem for mental health. We're agnostic in terms of the protocol taken. What we want to know is what's the indication you're going after? What's the unmet need? What's the IP that there's there? What's the efficacy? What's the team? What's the background of the team? It's all well and done. You've got great scientists, but do you also have the ability to raise capital? Do you have the ability to access deep pockets of funding, both from public markets and private markets and so on? So you have to sift through a lot, right? But our first fund, which is closed, it closed last year, just to tell you about the way the markets have behaved. The first fund has generated close to 400% return. The second fund is what we're on now. The exciting part is what we're learning in terms of these new chemical entities that are coming up, right?
Yeah.
Where we're learning from the first generation, and we're taking the approach that, for example, what PsyBio is doing, melding it with other aspects of being able to target receptors without touching other receptors. See, that's the biggest issue, really, that the SSRIs have. They do work in the sense that they target the receptor they're supposed to, but then they got to meet every other receptor. How you doing? How you doing? How you doing? How you doing? And we don't want them to do that. We just want them to target a particular receptor so that you don't have the side effects. And that's where this is going now. It's becoming more customized. That's what's exciting us, and I think it's pretty profound.
So there's a lot of research out there. We've talked about this a little bit. There's a lot of research out there, but how do you determine which research is going to result in a commercial viable market and a true biotech company, right? So that's what I'd like people to understand.
This is very complex, right? It's not just about getting a drug through the FDA, because a lot of these will get through FDA. The problem is, how do you commercialize? What's the delivery mechanism, right? What's the protocol which we're going to be administered? Who's doing the training? What kind of training protocols are there? It's very complex. You have to look at all those facets to be able to see which are the companies that really have the mechanism to be able to succeed in that protocol, and do they have all of that lined up? And we get surprised when we look at companies that not only do they have not paid attention to the IP, but their IP, intellectual property, is very loose, but also that they have given absolutely no thought to commercialization whatsoever, right? And that's one of the biggest things. We've seen publicly traded companies that have done very well in the public space, and they get their drug through the FDA, and then they weren't able to commercialize, and that stock came tumbling down. And that's a mistake you can't make in this industry.
And Jeff, can you talk about your company as it relates to substance abuse? Why is that a big market? Why did you choose that particular category? And what are you guys doing that's different from what's out there in the current marketplace?
I will defer to you about the training, because I mean, MAPS has done an enormous amount of heavy lifting on that front, a very, very important aspect. But we're starting with pain, actually, with ketamine. And we're using that as kind of the flagship to bring our device and delivery solution and formulation together, and then we will branch ketamine into other categories. We, of course, as I said, have the psychedelics as well. Those are a little bit behind where we are with ketamine in terms of our development program. But I would point out that there's actually, to some extent, kind of drafting on what you were bringing up, Andrea, that the psychedelics have effects on the body, mind, and the spirit. And actually, at the body level, it's actually so specific that it's kind of interesting and a little bit hard to understand. But they have anti-inflammatory effects, and they have a capacity to recruit neurons that have gone quiet, let's say after a head injury or closed, helmet injury in warfare or post-stroke. There are a lot of neurons that will often become quiet. They'll go quiet even though they're not dead. They just need to be recruited and kind of brought back into the fold. It's like, hey, come on back in, we need you. How can you get that to happen? Well, remember what I was talking about, to increase the ability of neurons to talk to each other and to escape from the inhibitory tone that happens. We know that these kinds of patterns get even more specifically set in after head injury. So we have a lot of different applications that are actually worth looking at. You don't have to always go big. Actually, small doses, the kind of microdosing model, and there are also certain models that are coming down the pike, which are probably lower doses of more friendly psychedelics, kind of gentler psychedelics, lower doses and shorter time windows, so that you don't have to get so much done in a single session. This might be a kind of winning model for people that are anxious, want to try these out, but are not kind of ready to go all in. It's kind of like getting into the shallow end of the pool a bit. But I think that those models will actually be coming along and will be attractive.
Liana, do you want to talk about what's happening with MAPS now and what's coming on the horizon?
Yeah, I mean, I'd love to also talk about the treatment protocol. It hasn't been brought up yet. So we're not talking about a psychedelic where you would get prescribed and take it at home. We're talking about psychedelic-assisted psychotherapy protocols. So these are with therapists who've been highly trained in the modality. The modality that we train is one where we really see the therapist's role as facilitator of an inner-directed experience, with the same idea that somebody mentioned, if you get an arm injury or, you have a cut, your body knows how to heal itself. It's the same idea. The mind really knows how to heal itself, and it's about putting the therapist there to support and facilitate a person's access to their own inner healing intelligence. And one of the most interesting bits about our data is that we found after our phase 2 that so we have about 68% of people at the end of the research no longer meeting the criteria for a PTSD diagnosis. These are people who have suffered with PTSD on average for 14 years. There's no known cure for PTSD. PTSD is a condition that people tend to live with and manage symptoms throughout their lives. A lot of these SSRIs are symptom management. They're palliative. They help they're like Band-Aids that help people cope and deal with what they're experiencing, but don't actually go to the root of what is causing their issues in their lives. And we found after we do our 3-month follow-up, we get that number, and then we completely stop working with the participant, but we found at the 1-year follow-up that number jumped by 10%. So people continued to improve without any intervention from the therapist or any communication from the therapists by 10% more 1 year after their treatment. And the treatment protocol that we're working with, our FDA design, is a 3-month protocol with 3 dosing sessions of MDMA, which are 6 to 8 hour sessions in a room with 2 therapists. And interspersed between those 3 sessions are 12 90-minute preparation and integration sessions. So you're looking at a 15-session period over 3.5 months. And that is what we're getting, these incredibly high results. And we also have found that 83% of people had clinically significant reduction in their PTSD symptoms. So there's just nothing else in the market that comes close to the results that we're seeing, which is part of why we're seeing all of this excitement, because these things are, these are real issues that people live with sometimes for their entire lives, and we're providing, in so many people, real relief that's lasting and durable. In addition to our PTSD research, we're also looking at eating disorders, which is another condition that is incredibly difficult to treat. We've done research in our history looking at end-of-life anxiety. Some of our partners are looking at smoking cessation, alcohol cessation. We've seen that also with psilocybin. You mentioned brain injury, traumatic brain injury. I spoke with a stroke patient last week who had their cognitive impairment come back online after using psilocybin. Ibogaine is another really interesting molecule for traumatic brain injuries. There's a group of veterans, Special Forces veterans, that have been working with Ibogaine and 5-MeO-DMT. There's a report observational study of over 200 Special Forces veterans, and the results are just astounding with the impairments coming back online, their cognitive function. So there's a lot of different ways and lenses that you can look at this through, but I just want to be clear that we're talking about not psychedelics in an isolated way. There's this theory in psychiatry that it's just neurochemistry that's happening, and but we're looking at the whole therapeutic approach and giving people these deep dive sessions, these expanded sessions. Most therapy sessions are a 50-minute hour, right? So a lot of work can get done in this short window.
Yeah, that's a good call. And I think what you're
touching
touching
just
on.
a really quick point on this, which is that it's also really important to understand that what Liana was saying is that the life-saving aspect, the kind of coming back to life of the human being that we're talking about here, you can imagine what that means to the social fabric that they're woven into. Think about what it means to their wife or their children or their parents or their community in terms of them being an active participant, because a lot of the problems with depression, extreme depression, PTSD is that people kind of feel like they're walking dead in a way. Like they're not really present in their lives and they're not present with the people that are around them. So the healing really has quite a ripple effect actually for society in general.
Yeah, it's a
Yeah,
global
it's-
epidemic, right? Most
Yeah.
depressed country in the world, China, according to World Health Organization. Second most depressed country in the world, India. Third most depressed country in the world is the US. But the US leads with substance abuse. This is a global epidemic.
Absolutely.
Yeah, I'd like to add on to what Liana said. You mentioned some of these other drugs. So we're here talking about psychedelics. There are a large number of psychoactive compounds, and they are all very different. I mean, we had an excellent conversation last night about some of these are far more docile than others, and what Liana just mentioned of 5-MeO-DMT and ibogaine are far more intense and take much well, and 5-MeO-DMT lasts 15 minutes to 45 minutes. But you think you could feel like you're gone for thousands of years. It's been described to me, and ibogaine, I believe, is about a 48-hour experience, very, very intense. You need to surrender to these. So they're all very, very different, which makes our industry really exciting and enormous growth potential.
So I think everyone's touched on this a little bit, but I think it's good to call out the risk factors, right? So there is this recreational market that we're all aware of, and is in a parallel track to the legitimatized full-blown clinical studies and medically derived pharmacology that we're working on. How can we proactively understand what those risk factors are and also manage them to make sure that it doesn't affect the legitimate market? So, Saad, do you want to address that a bit?
I just want to be careful. Like when we say recreational, for a lot of these molecules, these are very, very powerful molecules. And this whole concept of a bad trip you must have heard about, through many stories. And it can be a very incredibly taxing experience, not one that people want to go back to readily and voluntarily again and again, unless it's a particular problem that they're trying to solve, and they're trying to self-diagnose it, and they're trying to find somebody in the underground movement that can help them through the process, right? So it's not the party drug that many make it out to be, and as a result, there's a lot of comparisons to cannabis, which again, I don't think is right. Cannabis is an industry that's really driven by a revenue model that's for recreational use, whereas psychedelics, this is medicinal. This is very serious. This is about the right therapy, the right training programs, the kind that MAPS is offering, which is all guided, and you've got to go through a protocol if you want to do it right. The risks, look, the science makes sense. We're not going to argue about the science. The efficacy works. That's done. That ship has sailed.
Indisputable.
Right. The risks are in the plumbing, right? Okay, how does this get commercialized? I mentioned before. How is it accessible? What's the best delivery mechanism? Which molecule is best for which particular indication? Clearly, with what MAPS is doing, and MDMA is at the leading front for a lot with regards to PTSD, anxiety. And then there's others that are coming out with MDMA as well. Psilocybin has taken a huge forefront with regards to treatment-resistant depression, which by nature of the term, there's no treatment for that, right? It's treatment-resistant. So the risks are inherent in the actual the plumbing of it all. How do you and there's a lot of that hasn't been figured out yet, right?
Okay.
This is a long road.
Yep. And Evan, did you have a point of view on how, from your perspective, what is it that we're doing now to help legitimize this market, and how are we taking it to another level over and above some of the things we've already talked about?
Well, these drugs are Schedule I, most of them. So, we need to operate in an area where we're battling two agencies here. We believe that the path to least resistance to making these available to the patient population is getting it approved by the FDA, which is what we're doing and some of these companies are doing in the industry. There are some states that have decriminalized it. What does this mean? We're going to watch, but it's still federally illegal. So we're building our business model by getting it approved by the FDA and having the DEA reschedule it upon that approval for the indication that we file on.
Okay, and I think one of the things that's very interesting about this is in some ways we're stepping out of the lines, right? So we're stepping out of the lines of what we considered a typical pharmacology or chemistry model. So we're allowing the body to function on another level, but we're using the constructs of the pharmaceutical industry to legitimize this market. So we're using clinical studies. We have a multidisciplinary approach that's borrowed from, an oncology or cardiovascular model. We're doing the studies, or we're using the constructs to prove out that that these drugs work. So I think that's an interesting sort of way to look at it. And then the other juxtaposition that's interesting to look at that you touched on is how does this relate to the cannabis market? Because I think a lot of investors here have some experience maybe investing in cannabis, and people tend to put this in the cannabis category, but this is a completely different category for many reasons that you guys have touched on. So I would love to just compare and contrast what you think is different about this as a market relative to cannabis. So Jeff, do you want to touch on that?
I think that the important thing about following an FDA approval model is that it acknowledges the fact of the medical marketplace, the office setting. You know, what doctors want is a product that they know the quality of, they know it works, but they also know that they can actually apply it within their office. And I would just say that I believe that there are a lot of risks. There's no doubt about it. It's a complex treatment. I think they are going to be approved. But what I think some companies are not necessarily thinking about is what is the outlet for the product. And one thing I would point out is that psychiatrists are not proceduralists. They don't set up IV clinics. They don't learn how to do difficult procedural medicine very easily. You can teach them, but it's very hard for them to set that kind of stuff up on their own. It's expensive, costly. There are FTEs, expensive employees they have to buy, medical materials. So finding a way to bring these into the office and control the medical setting, control the onset, control the peak of the experience, basically get people to altitude and get them back down to ground and get them home and safe to their loved ones is a particular need that is not really being talked about that much. I will say that is actually our starting point. We've spent the last 5 years specifically trying to solve those problems. The parenteral delivery through the pump basically is it's like a mobile IV, you can think of it. And that's why we have done this. Other companies are thinking about it. I would keep an eye out for that. If you're looking at a company, you really want to know that the product they're developing can actually fold into existing markets. They don't have to invent an entirely new outlet for this product.
So any final words that you guys want to bring up and just talk about what your vision of the future is as it relates to this market?
Yeah, sure. I'd also just love to share that the recreational market is entirely separate from the medical market in psychedelics. And it's something that might come online in another 10, 15 years or so. We don't, the drug policy reform is definitely happening in this country. But I think one of the better ways to de-risk the research is to have a well-informed public. We have been deeply misinformed through the propaganda of the drug war about these substances and told all kinds of false stories. And so I think that there's, at MAPS, that's one of our goals is educating the public. That's one of our nonprofit goals in and how to safely work with these substances. And so I think that also helps us de-risk the massive investment into research that we've made, because we won't, if adverse events happen in the population, that could be bad for us. But at this point, the science is so strong that that is unlikely to happen. And then just in terms of the vision for the future, I imagine all kinds of care clinics emerging in all small towns and communities across the country, where people can get not only psychedelic assisted therapies and treatments, but other kinds of complementary healing modalities. We haven't really touched on what some call transformational technologies or spirit tech or wellness and meditation and all these other complementary integrative services and treatments that can really help a person once they've had these great, some call it an awakening or epiphanies through the use of psychedelics, to help them land and integrate. Integration is such an incredibly important part to these experiences, and that's another huge kind of sector of this industry that we didn't really touch on much today. But I can imagine these culturally competent, relevant healing clinics all over the country that are serving their communities in many formats where people can come together. We're doing a group therapy research right now out in Oregon. And so I think that might be applications for that as well, especially in the recovery community working with psychedelics. So that's what I hope for.
I think you bring up an important point. This is a really emergence between psychiatry and psychology and health and wellness, right? So these are three separate industries that are converging into one marketplace. So that's a really interesting way of looking at it. So Jeff, any final words in terms of what you're excited about? What's the vision of the future market, let's say 5 years or 5 to 10 years from now?
I think that we're looking at a vista where there are going to be new tools available to a field that has been desperately in need of those new tools. And so I'm excited that there will be many different flavors. I don't think there's going to be one treatment. I think there will be many. And I think that there are so many niches and ways to think about it, from, again, low dose for anti-inflammatory effects to medium dose for kind of softer effects, even to the high dose for PTSD and for kind of full transformation. But I think also, I feel personally, I'm so all in on this, the dedication. It's a very specific mission-driven field, and the people that are in it see the potential. I think, if you are looking at trying to do impact investing, this is a field where you will make a big difference. A lot of companies need help to get to the finish line, and it will be also a nice return. So I think it's a win-win at so many levels.
Yeah. I think SAAD has already shown that with his 400% return. So can you tell us a little bit about your final words
Sure.
and also why do you think you got that kind of a return? I mean, just give us a view into, the financial part of this as well.
Well, luck and skill. Let's just say, don't know what percentage is luck and what percentage is skill. We tend to do well, but William Blake in A Marriage of Heaven and Hell has a wonderful line that was the title of Aldous Huxley's book as well, which is that if you cleanse the doors of perception, then one would view reality for what it is, which is infinite. And I'd love to see a point in time in the future where we can talk about getting a reset, because that's what many call it in the industry, where you inhibit the inhibitor and it allows you to solve your problem because you're looking at it from a different lens now altogether, or more lenses, I should say. But that you would go and have a reset as part of a mental hygiene, just like you go to a dentist for dental hygiene.
Yeah.
And there'd be no stigma associated with that.
Yeah,
Right?
that's great.
Because the indigenous communities, and when you look back 6,000 to 8,000 years ago, these were tools that were used by nobility. They were not allowed for the common hoi polloi or the common man or woman, but it was for nobility, and it was used for wellness. We're not having discussions about wellness yet. We're really fixated on illness, but that's the natural progression.
So we're really modernizing ancient wisdom, essentially, and bringing it to the forefront into our existing constructs.
A lot of ancient wisdom is being modernized in so many different aspects, yes.
Great. Evan, final words?
Thank you. So to add on to what you and Sal were just discussing, Dr. Albert Hofmann synthesized psilocybin LSD about 80 years ago. So that's when the commercial endeavor started. And we're on a pathway here that these drugs, they were tested back in the 40s and 50s. Thousands of patients under similar categories we're talking about today, anxiety, depression, PTSD, experienced this. And the results were indisputable, incontrovertible, that these drugs have healing powers. However, what we're not talking about, Saad just touched on here, is that there are far more, and wellness is important too. The country, just woven into our zeitgeist is microdosing, and everybody has heard of it because it's all over the news. It's very popular. I mean, the jury's out whether it really has an efficacious response, but certainly at least having a grand placebo response. But these drugs are consciousness expanding, and a couple of examples, we could argue whether Francis Crick really did discover the double helix, but he does take responsibility for it. He attributes that success to LSD. Fast forward just to modern times, Steve Jobs believes that he built, a technology giant because of his LSD experiences. So using them, and we're not there yet, but using them to improve wellness is also, a benefit to society.
And I think what people don't realize is that some of our major institutions, pharmaceutical companies, some of our major academic centers are all involved in this. So if you can just quickly, just as we finalize this, talk about really quickly who's involved, which pharmaceutical companies, and which academic situations, and we'll end on that.
Sure. Well, famously, Johns Hopkins has been pioneering psilocybin research for many years, since 2008, I believe. We now have research centers at Harvard, Stanford, UCLA, UCSF. Down in Texas, UT Austin has a psychedelic research center. We've got some other more academic places in Wisconsin, and who am I forgetting? I mean,
there's Yale, there's Harvard.
Yeah.
They're all got
And
not
which
only
pharma,
centers,
which
NYU.
pharma
centers.
companies do we
Like,
have
oh,
involved?
Boehringer Ingelheim, Aventis, Sanofi Aventis, Eli Lilly, AstraZeneca, J&J, of course, is front and center. All these big pharma guys have had, Otsuka, they've all had CNS departments.
Yeah.
They closed down the CNS departments or put less stress on it or less focus on it because oncology was making a lot more money,
Yeah.
right? But now this is picking up again because we are in the golden era of neuroscience.
So it's a new category that hasn't been really exemplified yet. So.
Yeah, and all these guys are back. They're all coming back.
And
Imperial College of London is another big one I want to mention.
So I just wanted to take the time to thank each and every one of you for helping us take a deep dive into this very quickly. And just want to, if everybody can give a round of applause for the panel.